Hi, everybody. Welcome. We're so glad to have you here today. My name is Jennifer Butler. I am the Executive Director of Texas Liver Foundation. The mission of Texas Liver Foundation is to inform Texans about liver health and liver disease, and to improve their quality of life and outcomes through education, advocacy, and partnership. Now, before we get going, I want to go over just a few housekeeping items. Please be sure to keep yourself muted during the presentation. We will pause for questions as time allows, most likely towards the end of the webinar. If you have a question, you may unmute yourself at that time. Please remember to keep your questions general in nature. And if you're uncomfortable speaking, you may also type your question into the chat. Today's webinar is being recorded, and if you would like to see that recording, we will have it posted on our website, www.texasliverfoundation.org, in the next week or so. And let's dive into it. We are so excited to be here today. We are extremely honored to be joined by Dr. Rashid Khan with Houston Methodist Baytown Hospital. Today's program was made possible by Houston Methodist Baytown, and we are so grateful for their support. I was introduced to their team just a handful of months ago and just love the partnership that is being formed between the hospital and TLF. The team at Baytown is exceptional and attentive, and the facility is stunning. And I wanted to take a nap there. It was very stunning and relaxing. Texas Liver Foundation looks forward to a long relationship with Methodist Baytown, spreading important messages like the one you're here to hear about today, all across Baytown and beyond. And here to talk a little bit more about the hospital is Renee Ivy. You're muted, Renee. There you are. Hi.
Are we together? Good morning. So happy you could all join us. You are in for a treat this morning. I first want to tell you a little bit about the hospital where Dr. Khan works. We are Houston Methodist in Baytown. We serve 3 different counties: Harris County, Chambers County, and Liberty County. That's 400,000 people. So we have almost 200 beds here at the facility where we treat patients. Dr. Khan is one of the many service lines that we offer here. We have a complete cancer care system, as well as Dr. Khan, who treats not only patients with disorders of the GI, but also transplant patients. He treats those pre and post transplant. We have a DeBakey cardiology team. We have a full service cancer center, as well as a surgery department. I don't want to take a lot of time from Dr. Khan. I just want to tell you that we know no one wants to spend time in a hospital, but we hope that if you find yourself in need of a hospital, you will come to us. We have state-of-the-art facilities. We have everything here that you could want in a full-service hospital, and we are rated the top 2 in the country for several different accreditations. And so this is the place where you want to be to have any of your medical needs met. So I'm not going to take a lot more time. You are truly in for a treat today with Dr. Khan and the messages that he has to share. He is often requested to speak for physician groups, as well as a very, very popular speaker for community groups and consumer groups. So is there any other information we need to share about housekeeping, mute on or off, and cameras, Jen, before we turn it over to Dr. Khan?
No, I don't believe so.
Okay, Dr. Khan, we're going to hand it over to you.
Thank you, Renee.
Thank you, Renee and Jennifer, both. Welcome, everybody. For the next about 30 to 45 minutes or so, we would be talking about non-alcoholic fatty liver disease. And before I start the talk, I would like to acknowledge Texas Liver Foundation, as well as Houston Methodist Baytown Hospital. There are many people behind the scenes. You know, you just heard 2 of them. There are several others. They've put in a lot of hard work to arrange this with all the audiovisual arrangements and everything. And certainly I'm just speaking here, but there's certainly a lot of people behind this. So, you know, all credit due to them. Anyway, let's get started. I see some folks are online, and I'm sure others will join as well. So this is just a very general talk. I've given this talk, the last time I spoke about this was in the fall of 2019. And we all know what happened since then. So this message has been due coming. You know, it's not that we forgot about fatty liver, but we got occupied by COVID and the whole world changed. But fatty liver is still here. You should know that your liver performs over 500 functions. It's actually more complex than the heart, you know, so however beautiful the heart is, it pumps blood, it keeps us going, it keeps our pulses going. The liver is very complex. It acts like a filter. It processes everything we eat and absorb through our skin. It helps build muscle. It makes bile. All of you have heard about bile. You know, bile helps digest food. It kills germs, stops cuts from bleeding, and most importantly, or one of the more important functions is that it's as I said, it's a filter. So it detoxifies substances that are harmful to your body, similar to the kidney, but of course does a lot more functions than the kidney. Advance, please. Okay, so important terms to remember, to know, and as I said, this is a message that we need to get out there again. Since, you know, the COVID years, we tried to get this talk out there. Fatty liver is a big problem, and on the next slides, you will see what it is. I'm just going to read these statements and try to make them simple, because you will see them across the board. By the way, October is National Liver Awareness Month, for those of you who didn't know. So, you know, it's very opportune time that we're talking about this. So there's non-alcoholic fatty liver disease. The new term by the societies is actually metabolic dysfunction associated steatotic liver disease. Steatosis means fat. They wanted to take away the word alcohol, basically, from this. You know, they didn't want to stigmatize anybody. So they just wanted to make it a little more general, and you may see both terms. Non-alcoholic steatohepatitis, that's when things get interesting. That's when you start having some liver damage. Fat itself does not harm the liver, but if that fat is allowed to stay in the liver for a long time, then it leads to more inflammation and damage and fibrosis. And the word I use for fibrosis, the simple word is scar tissue. So people understand scar tissue. You know, you're building scar tissue in your liver. So another term similar to that is metabolic dysfunction associated steatohepatitis, and then cirrhosis. As I said, scar tissue, severe scarring of the liver. And fatty liver can lead to cirrhosis of the liver, and there's a less risk of liver cancer. Now, important point on this slide, and I still get folks in the office who think that you get cirrhosis from drinking, and that is only partially correct. Drinking is only one of several reasons a person gets cirrhosis. Actually, the more common reason now is fatty liver, which is directly tied to lifestyle and weight. So the message out there is really, it's not the alcohol. Alcohol is only one reason. We come people in the office say, I don't drink, so my liver should be healthy, correct? Not quite. You know, their lifestyle isn't the most healthy, or their diet, I should say, they're overweight, and all those things put them at risk for fatty liver, even if they don't drink. So that is a very strong message, that your liver health is still at risk, even if you don't drink. Most people equate drinking with liver damage, and that's about it. Some people know about hepatitis C, and of course, these days we have good treatments for hepatitis C. So that's not much of an issue as it used to be. The important thing to realize is that fatty liver related to diet, weight, etc., can give you cirrhosis. And liver cancer, there's about a 4 to 5% risk of liver cancer. Liver cancers are not pretty. The ones I've seen are pretty advanced sometimes, and they're difficult to treat at times. So this is important to be mindful of. Next slide, please. Okay, we already talked about some of this. Fatty liver is buildup of fat in the liver. Some fat is normal, but when it gets to more than 5 to 10%, a person can develop fatty liver disease. And here's another very, very important point. Point number one, if somebody's writing this down, you know, is that alcohol isn't the only issue. You know, fatty liver comes even without alcohol. Point number two, extremely important, extremely difficult for patients, extremely difficult for doctors, and challenging, is that you may have no symptoms. Just think about that for a second. 0 symptoms, and there's a disease brewing in you. Unlike, for example, heart disease. You know, Renee mentioned our wonderful heart center. Well, of course, people get chest pain, correct? They get angina symptoms. They go see a heart doctors, a cardiologist who take care of it. People come and see me. We really have to play detective. Somebody has figured out that they have fatty liver, but they have no symptoms. So that's when we need to dig deeper and see why they have fatty liver and what's the extent of the damage. Fatty liver can occur in people with normal weight as well. It's rare though, and we already talked about it could lead to cirrhosis. The important point, however, is the last bullet, is that it is reversible if detected early, or at least we can prevent it from progressing. Next slide. Okay, so I think pictures speak more than words, and you can clearly see the slide where there's a healthy liver, and at the bottom there's a liver with fatty liver damage and cirrhosis. The liver becomes yellow and tanned and becomes scarred. And even those who are not in the medical field, I think, can appreciate that the bottom image, the bottom organ, looks unhealthier than the top one. Next slide. Something very similar in a different, actually this is more dramatic. And being a liver physician, I've, I don't perform transplants, as Renee said, but I have seen patients come after liver transplant, before liver transplant. I've actually even I've scrubbed in a liver transplant as an observer. One of our surgeons was kind enough to let us do that. And the liver you see on the right, that actually is the liver that comes out of the person's body. And when they transplant a healthy one, the one on the left is the one I've seen going in. So the liver on the right is somebody that is, the liver on the right is what people with cirrhosis have in their body. So it clearly doesn't look pretty. Look at it, it's scarred, it's yellow, it's nodular. And actually those nodules are the ones that are where you may develop liver cancer. Okay. So fatty liver disease, and I'm just going to use the term fatty liver because it's easier other than NAFLD and MASLD, but you may see both in publications and newsletters, etc. It's a big problem, right? It's look at the numbers, 100 million Americans. So that's a third of the country. Texas is a big state, so you can do the numbers in your head. But a third of the country may have fatty liver, and about 25 million may have some advanced stage of fatty liver, where you remember that scar tissue buildup. So the numbers are big. These are not small numbers. We're talking about millions of folks, and Texas being a big state, big issue in the South. Other risk factors are the two big ones are really weight and diabetes. And how many people we have here with issues with weight and diabetes? A lot, right? I mean, I see them as well. So weight, diabetes, this whole cycle, fatty liver, leading to 100 million people, 25 million might be a little bit more trouble. These numbers are big compared to, we talk about other common diseases like heart disease, cancer. These numbers are very similar. So we have to pay attention to this because it's important. You can get cirrhosis. Once you get cirrhosis, there's a lot of complications. You can get liver cancer. And B, we don't have enough livers to transplant into people, right? We don't have 25 million livers. In fact, we have a much smaller number. So that's why it's important to pick this up early and try to do things to reverse it or at least prevent it from progressing. And I'll touch base on a few of those. Last bullet is also very important. I don't see pediatric patients. I don't see anybody under 18, but those in the audience that have children, grandchildren, youngsters, teenagers, pay attention to your teenagers and your youngsters because it is increasing in children, fatty liver. As I said, I don't see them, but I've seen people with full-blown cirrhosis and fatty liver at age 30. Okay, 30, 32. Well, they started developing fatty liver when they were 8, right? So it makes sense from age 8 and now they're 30. 30 is still very young, and I'm telling them they may have cirrhosis at 30, 32. So that takes them back. They're like, I'm very young for this, and I don't drink, and I didn't party in college. Oh, I ask about their weight. They've been, as they say, a chunky kid for a long time. So that's how they develop this issue. So pay attention to the children as well, please. The risk factors already mentioned: weight, diabetes, high cholesterol, certain medications. Really, the top two are probably the most important in this. Clearly, weight and type 2 diabetes, which is very prevalent. And again, it's you know, the reasons are many. Lifestyle, our diets, you know, sedentary lifestyle, lack of exercise, so on and so forth. But this is important to pay attention to. Next slide, please. This is here. I mean, again, the picture speaks more than words. Obesity trends among US adults. You can look at the map of the whole country. There are only 2 states in yellow, and even they are not immune to this. I mean, those states have about 25% obese folks. So that's 1 in 4. Everybody else is orange or red. So everybody else is in trouble. Red or deep red. States, our neighbors in Texas, you know, to the east here and to the north, you know, their obesity rates are about 40–45%. Texas is about 35 to 40%. Just think about it, 4 out of 10 people. 4 out of 10 people. So you look around, you go to your Target, Walmart, and that's, you know, every 4th person out of 10 has this issue with weight. And if they have an issue with weight, then guess what? They may have fatty liver. And that's the whole talk. Next slide, please. Okay. So BMI is one way to assess for obesity. As I said, some people who are lean may also have fatty liver, and visceral fat may be better assessed with waist circumference. I do want to make a point. An important point here is that know your numbers. This is very important. Doctors say this. You may have heard people say this. Know your numbers. So numbers know what your cholesterol is, what your blood pressure is, what your glucose levels are. And for this talk, all of those are important, but also know what your weight should be. I get surprised so frequently in the office. And in fact, I would say almost nobody gets this correct. For some reason, both men and women are guilty. Nobody knows what their ideal weight should be. Just about nobody. Just about. I can't remember the last time somebody told me, and I was like, okay, oh yeah, you're correct. They always give me a number about 20 to 30 pounds north of what it should be. So please know your numbers. A 6-foot man should weigh X. A 5'4" woman should weigh X. And I always hear numbers that are 20 to 30 pounds over. So people don't know their numbers, and this is easy. This should not happen. I mean, I'm not trying to make anybody feel guilty or what have you, but you can go on internet. I mean, ideal body weight for 6'2" man, ideal body weight for 5'4" woman, age, and you can plug in the age as well. It doesn't change so much with the age, but know your numbers, right? Because if you don't know your numbers, you don't know you're overweight or obese. Some people know that they're a little heavy, but they don't know how much heavy. I think I'm maybe 10 pounds heavier, where in reality, they're 40 pounds heavier. So they don't really know their numbers. So it starts by knowing the numbers. That's probably my 3rd important point after the 2 I mentioned, is that know your numbers. If you don't know the numbers, then somewhat this talk becomes pointless. Next slide. Okay, so just BMI numbers. This is one way to look at things. And again, this is a very simple calculation. We won't delve into it. You can go online, you can plug in, there are many calculators. You put in your weight, put in your height, or at your doctor's office, they do it frequently. You know, attempt to be in the normal range, of course, 25 to 30. People don't realize, but that does come under overweight. I mean, it's so common here. I see so much in Texas that it's really hard. People don't even realize that. But we really need to start paying attention to this, because even being overweight, and if you are diabetic, you have high cholesterol, you smoke, for instance, puts you at risk for a lot of the conditions, right? Fatty liver, but also what? Heart disease and other things. And of course, obese, if you're 30 and over, that's sort of the red that I showed on the map. So you're in the red, right? I mean, we have to go from red to orange, orange to yellow, and hopefully from yellow to green, right? There was no green on the map. I think there was, but there wasn't a state in green. So anyway, these are the numbers. These are all facts, right? I mean, this is not made up stuff. These are all facts. This is all reality that we see. And, you know, I've been doing this for a long enough time to see enough fatty livers and more than enough cirrhosis that I care. And people sending them down to the medical center here in Houston for liver transplant who do a fabulous job. But as I said, we don't have 25 million livers to put in people. So why get there, right? I mean, try to prevent yourself from getting full-blown cirrhosis with its issues. Next slide. As I said, fatty liver is so tricky because you may have none of these symptoms. Nausea, loss of appetite, fatigue. These are all very non-specific. Okay, these are so non-specific. A lot of my patients, I see them, they're fatigued, they're tired, they have some nausea. I mean, then that don't necessarily mean you have liver disease. They may. So that's the issue. That's one of the important points I made, is that this condition needs to be aware, needs to have an awareness. People, the public, the consumer, and the physicians. And I think there's a lack of awareness in the public, in the consumer, because they equate alcohol with liver disease, not fatty liver per se. We're trying to change perceptions. And even physicians, because outside of somebody like me, a liver specialist, or some of my gastro colleagues, the primary care offices, you know, that folks go to, I've seen a lot of people come out from them. I've known about fatty liver for 5 years, 10 years. My doctor said it's no big deal. I just shake my head, or I, you know, just want to kick myself. It's no big deal, because now they send them to me and they have cirrhosis. And had somebody told them 10 years ago, you have fatty liver disease and, you know, you're 20 pounds overweight, take care of it, 10 years later, they wouldn't be seeing me, right? Does that make sense? So primary care doctors telling them it's no big deal, I would use the word that's criminal. I mean, I've seen it again and again, no fingers pointed, no names taken today. But a lot of primary care physicians need to have this awareness too, that fatty liver is an issue. Either you address it, you dig deeper, or send them to a liver specialist, somebody who knows what they're going to do, and talk to the person and, you know, try to get them on the right path. Next slide, please. Okay. Some of these things we've already talked about. I would mention that because it may have no symptoms, it's really hard to pick. So again, I've already mentioned this, it's all about being aware. If you're overweight, know your numbers. People don't know their numbers, that's the first thing to start. Know your weight, know your diabetes, numbers, cholesterol, etc. If you are 30 pounds overweight, if you're 19 pounds overweight, you may be at risk for fatty liver. Talk to your doctor, bring it up. If they don't bring it up, you bring them up. You know, am I healthy? Is my heart good? Is my liver good? I heard something about fatty liver. What is that? Can we talk about that a little bit, right? I mean, that's the doctor's job to talk to you. What are my liver tests? Are my numbers good? You know, so liver tests might be abnormal to begin with. Sometimes the issue is the primary care doctors don't really know what abnormal liver tests are, because they don't show up in red on the lab slip on your Quest lab. Only a liver doctor or gastro doctor, they can dig deeper and say, okay, this is not in red, but it's still a little high. A primary care doctor may dismiss that for several years, but a specialist might pick that up sooner. And then, of course, the other big one is ultrasound. Ultrasound's a very easy test, not very expensive. You can get an ultrasound done of your liver to see if that picks up any fat, any fat changes in the liver. So these are all early signs, right? I mean, the rest of the talk, I want to focus on fatty liver. I think I've done enough scaring. I don't want to scare you on liver cancer and cirrhosis, but hopefully we don't see folks in on that spectrum. But fatty liver is where we'd want to pick them up sooner and then intervene at that point so they don't get to the other spectrum. Next slide. Okay. So treatment is, I think I've laid the foundation. I've talked about fatty liver, what it is, what it entails, and what it could lead to. And now, how do you treat it? How do you avoid it? Well, that's also tough. This is tough, even as a liver specialist. It's tough, it's frustrating, because there's no one quick fix. Let me get the simple question out of the way. There are no pills. In October 2023, there are no pills yet. They may come. We're doing a lot of studies, a lot of research studies, trials, but there's no pill that's really out there yet. You know, a lot of them are close. Well, I shouldn't say a lot of them. Some of them are close. But the pills probably will not work 100% or 90%. They may help 50, 60%. Well, I'll give the example of hepatitis C. Hepatitis C, they're great pills now. There weren't hepatitis C pills before, they're great pills now. Cure rates are close to 100%. This is different. Fatty liver is different. We don't have anything, even if it comes out, it's not going to be 100%. But I can share with you what is 100%. And that is lifestyle changes. Change your diet, start exercising. Change your diet, start exercising. We can look at the diet chart, advance. So this is what, so certainly I want to start by saying that I'm not a nutritionist. This is not a nutrition lecture. It's a general lecture. It's more information about fatty liver. So we're not going to go deep into different types of diets. This is the food pyramid that they used to tell us: eat plenty of bread, cereal, rice, and pasta, several servings a day. Okay, well, that clearly was not the right message. Next slide. What I say is have a balanced diet. These groups: healthy grains, healthy fats, protein, vegetables, fruits, but be sensible. Okay, let me give you the example of fruits. So instead of pouring 2 glasses of orange juice from the bottle, eat an orange. Okay, I mean, don't go with processed foods, things in a box, things in a can. Get your vegetables, buy them and cook them at home, because you know what you're putting in them. Get things in a can, get things in a box. You never know what's in them. You read labels, how much saturated fat. I don't know if this is good or bad. Try to cook as much as you can at home where you can control things. You can certainly go online. You can have a visit with a dietitian and nutritionist. We have several good ones here in the hospital who can give you a more detailed breakdown about diets. But the thing is that all diets do work. You just have to stick to them. You have heard about keto diet, South Beach, Atkins, I don't know, Jenny Craig. These are just a few come to mind. They do work, but you have to stick to them. And I would say you have to stick to them consistently for 3 to 6 months, really. It's not like you go on a diet for a month or 2 weeks and okay, you're happy you lost 7 pounds and that's it. This has to be more sustained. So it starts by diet. It starts by movement. Okay, movement is golden. That's the second thing I have to say. Movement, regardless of your age, you're 50, 60, 70, 80, movement. I see older folks that really don't move. They don't want to move, whatever the reason might be. It's not that they're unable. Sometimes they are unable. Sometimes they just don't feel like it. You have to move. Next slide. We can skip this. I think we talked about this already. So again, the diet message, and again, of course, I would just throw all the fast food out there completely. Once in a while cheating maybe, but other than that. And as I said, the point is about the children and the teenagers. Even be careful with them. Make sure that they're not consuming a lot of your fast food joints and things of that sort, snacks, etc. Okay. We kind of touched upon this already: healthy eating, lean meats, bake things, roast things, avoid frying. Air frying is better than your traditional frying. Healthy snacking, instead of reaching for that slice of cake or brownie or cookie, etc. Keep some nuts. I keep some nuts in my office. So a little bit of healthy snacking rather than junk food. Okay, so what's recommended by several societies is at least 150 minutes of exercise per week. And note that number carefully. It's 150 minutes a week. So you can divide that over 7 days. You can divide that over 5 days. You can divide that over 3 days. That's totally up to you. But some form of balanced exercise, not just hitting the gym and lifting heavy weights, or not the other way around, just some aerobic, a little bit of combination of both. Because remember that muscle or protein and muscle, that burns fat as well. So some sort of resistance training is important too. A little bit of light weights. But of course, you also want to get that heart rate up, that cardio, and there are many forms. It doesn't have to be running, or people have bad knees. So there's bikes, right? You can ride a bicycle, stationary bike, there's elliptical. You can get in a pool. We have a lot of opportunity to get in a pool in Texas. Get in a pool, water exercises, and you just take a few laps across. And if somebody's done it, it's extremely hard walking in a pool. And if you put some effort into it, it's even harder. So you do that for 15 minutes and, who knows how much calories you burn. And of course, summertime, you enjoy it, the water's cool and all that. So that's important too. So it's food and movement, just the combination of both. What I'm telling you, what I'm imparting to you isn't rocket science. This is something we know. It's just about doing it, right? Just about doing it, having the discipline to actually do it, and do it for yourself. Do it for your health, for your liver, for your heart, for your overall health. Because, the message is clear that this fatty liver isn't something to be trifled with. Next slide, please. These are some of the resources that I would like to point out. TexasLiverFoundation.org. It's a wonderful website, as Jennifer alluded to. They're dedicated to the liver health, improving the liver health of all Texans. That's their mission, and there's a lot of Texans at risk. You saw those numbers, 100 million, 25 million. That's nationally. You can do the math, come up with the Texas numbers, for the population. So Texas Liver Foundation has their work cut out. We have our work cut out. Houston Methodist and other facilities, liver doctors like myself, have our work cut out because there are not many of us, as you may or may not know. Not every gastro doctor is a liver expert per se. Some of them are, most of them aren't, so I have some extra training in liver disease, but sometimes even gastro doctors aren't well aware of the recent developments in liver disease. So there aren't many liver specialists. You'll find them in big places. You'll find them in Houston, Baytown is our satellite, Dallas, San Antonio, some of the bigger centers in the city. But outside of that, there's really a paucity of knowledge, or doctors who even know much about liver disease, So it's important to try to link with somebody. Our number, our address, our website is there. We're welcome. You're welcome to reach out, and we're always happy to see you. I think that's all I have to say, and I will open it up for any questions or any comments, and we will take it from there and then conclude in a few minutes.
Dr. Khan, thank you so much for this information, and thanks for spending your time with us today. I didn't mean to butt in first, but I did. I have a question for you. Are there any demographics or age populations that are more or less at risk of fatty liver disease?
Yes. So again, no blanket statement, or this is not to point out towards any particular ethnic group or anything of that sort. But it is a fact that it's more prevalent amongst Hispanics. African Americans are actually somewhat protected for some unclear reasons. We don't see a lot in that ethnic group. Very prevalent in Hispanics, extremely prevalent. The Caucasian population is somewhat in the middle. Age-wise, not so much, Jennifer. Age-wise, as I said, my pediatric colleagues have told me they see 12-year-olds with this. So now if you're feeding your 12-year-old what I already told you, not feed your 12-year-old, unfortunately, that 12-year-old child will have this issue. And I would say his parents are at fault, his or her, right? The parents are at fault. The 12-year-old doesn't go to the grocery store. It's what you put on their table. I have teenagers a little older than 12, but it's what we put on the table. So age-wise, no, sadly. Sadly, people think you get diseases more as you get older. Okay, I'm 60, 65, something's going to pop up. I see a lot of people 25, 30, 35, fatty liver. These are young people, some with small children, some with no children. They haven't even gone along with their lives yet, mid-20s, fatty liver. So age-wise, no. Demographic-wise, Hispanic population, and that's, where we are, right? South Texas. So we see plenty, and unfortunately, also plenty of the same Hispanic population with cirrhosis and liver cancer. That's for another talk. But my colleagues in Houston, they see a lot of liver cancer in that subset. Does that answer your question?
It does. Thank you.
Okay. I see a chat here. Do I click on this, or are you going to field the questions for me?
I got it.
Okay.
Mary has a question.
Yeah, actually, I have two questions. First of all, could you give us some advice on how you would kind of push your doctor if you have you get your blood test results sometimes even before you see your doctor, and they're highlighted as abnormal on some of the liver ones, but the doctor says, oh, don't worry about it. How should you push on that? And then my second question is, you said there's really no pill you can take. I wondered if they're doing any studies of these new obesity drugs that we read about that everybody's trying to get, and whether that might be something that would help.
Yes, so two questions. The first question is, how do you push your doctor? That I can try to answer, but I don't think I can really tell you or your doctor how to push them. And your question is very valid. Your question is very valid. Unfortunately, what I recommend is a little bit more engagement with the doctor. I don't think your doctor will be offended. Some might, small portion, I guess, but I think doctors do appreciate patients that are well aware and, they've looked at their blood work. Certainly one thing I do discourage, and I don't mean to say you do it or anybody else on this talk, is that don't go online and on Google and look up things, because then there's also a lot of misinformation. But certainly liver tests being abnormal is important. And that's something you can politely ask the doctor, what do they think about this? They are abnormal, you can't just say, don't worry about it. I guess they can. I can't speak for another doctor or the primary doctor. But I think if you bring it up a few times, they will look into it. They may send you to a liver doctor like me or a gastro doctor. And then we can dig deeper into it. We can start with an ultrasound, or simple enough, your primary care doctor can start with an ultrasound, right? That's a very easy test, not super expensive. Liver tests are abnormal, get an ultrasound. Maybe it's fatty liver, maybe it's your gallbladder. Okay, maybe it's your gallbladder, then we go look at the gallbladder, take out the gallbladder. So I think that's something that I would advise. And your second question is also very relevant. And actually, that's something that we are, as we speak, we meaning Houston Methodist, other facilities in Houston and across the country, we are doing trials on these drugs. So these are called GLP-1 drugs. Basically they slow down your stomach. Ozempic, Mounjaro, these are some examples. Wegovy, they're ads on television. I have patients on them. I see patients from other doctors, endocrine doctors on them. It's a hot area. This is very relevant. These drugs, they do help. Now, how far they go, I think it's early for me to say in October 2023. But if I speak about this in October 2025, I might be able to tell you, okay, now we do know because we have some data, right? We have 4 years of studies on Ozempic, on Mounjaro. This is what they did for the weight, for the diabetes, and for the fatty liver. So the question is very relevant. The answer is yes. And I would say there's more to come.
Thank you.
You're welcome.
Dr. Khan, we have two questions in chat. The first one, how can someone tell if their liver functions are getting better or worse?
Well, that's simple blood test. Unfortunately, well, I won't say unfortunately, but that's the simplest way for us to tell. And there are two enzymes to look for, ALT and AST. So just remember that, ALT and AST. And these are enzymes. I will say that the normal, to the people listening, now you know as much as a liver doctor. Your primary doctor may not know this. A normal ALT for a man is 30 or less. And for a woman is 20 or less. So if you're a man and your ALT, that's the more important. I said there's another one, AST, but ALT is more important. If your ALT is, say, 41, okay, you're a man, you're a 45-year-old Hispanic male, you're a little on the heavy side. Your ALT is 41, it may not highlight on Quest as abnormal. I think you get the point. That's something that may not be recognized by anyone, but you can pay attention to it now. Sadly, your primary care doctor may not know about it. We hope to give this talk to them as well. Or maybe there are some on the line that should know that ALT of 41 is a little high. Next time it's 39, next time it's 43. So it's not 80, it's not that elevated, but it's abnormal. So you need to pay attention to that. And you do serial checkups. That's how you know if they're getting better. Let's say you do a first test, it's 70. We suspect fatty liver, you come back, you lost 25 pounds. It goes from 70 to 41. I would say that's great. It's getting better. We're on the right track. Okay. But first thing is recognition of it's abnormal, especially for women. 20 is not a high number. ALT of 20. We see plenty of women who have enzymes, ALT 33, 31. Nobody picks them as abnormal. I mean, they're a little on the heavy side and they have fatty liver for years. And then one day that 33 becomes 63, 64. So had we intervened at 30, if they had worked on their lifestyle, we talked about diet, those 150 minutes of exercise, we maybe wouldn't have gone to the enzymes getting worse. So that's how I think you can, I would say you can know if your liver tests are getting better or worse, conversely.
Thank you. The next question in chat, do you think fatty liver disease might cause diabetes as well or bidirectional?
Excellent question. I would answer the question with a question. What came first, the chicken or the egg? That's hard, but there's a close connection. There's a close connection as I would really make a pyramid, a triangle with 3 corners. We would put fatty liver, weight, and type 2 diabetes at the 3 corners. Almost all 3 present, in several folks. I mean, it's rare to see, not rare, we do see some people who are non-diabetic and have fatty liver, but the vast majority I see are diabetic, they're overweight / obese, have fatty liver. So yes, it can be bidirectional. It's really hard to prove which came first, chicken or the egg. But again, that's a strong association that we do know. Yes.
The next question, and I actually get this quite often. Are there any supplements you can take to help with fatty liver? We get that question all the time. What's a supplement I can take?
2, I would mention, not that I advocate them, but people may read them on or hear about them from Dr. Google when they talk to Dr. Google, is milk thistle and vitamin E. Milk thistle, the jury's a little bit out. At one point, the study said it helps, and now they're like not so much. Vitamin E, there are some studies that say it does help, but only if you're not a diabetic and don't have cirrhosis, and about 800 units a day. So vitamin E is known to help based on studies. However, there's not so much excitement among liver doctors in 2023. I'm talking about a decade back when we didn't really have anything else. Sometimes we still say it, you can take vitamin E, but a lot of folks are diabetic, so it's not really studied or well known with diabetes. Plus, there are some risks, some heart disease, some risk of prostate cancer. So we don't want to say, okay, you took vitamin E for 2 years and you got some heart disease. So maybe you helped your fatty liver, but caused another issue. So I would mention those. In general, just to take that question further, I would say there's really no need for supplements. The liver is a beautiful organ. Remember that. It's a beautiful organ. It takes care of itself if you take care of it yourself. Alcohol, weight, taking it a step further, this is not the talk for this, but of course, injection drug use, and that goes with viral hepatitis C and all that stuff. Don't do all of that. The liver will take care of itself. You really don't need supplements per se. Drinking to a minimum, keep your weight in the normal range. The liver will detoxify itself. You really don't need to add supplements or things like that. And secondly, supplements can hurt. Sometimes you get a supplement from some Chinese drugstore. Who knows what's in that? We've seen people who took a supplement that thought they were helping their liver come to our office with jaundice. In fact, they're now sicker than what they were before. So be careful with supplements.
Thank you. We have we have another question in chat, but Rebecca, go ahead and unmute yourself and chime in. Rebecca, when you're ready, unmute yourself and chime in. I'll go ahead and ask the last question for now in chat. From NAFLD MASLD perspective, do you think waist circumference or skeletal muscle mass index is more appropriate than BMI?
Waist circumference. Waist circumference. That is an independent risk factor. Visceral fat, it's truncal fat. Another term is truncal fat. Trunk around the waist, pant size. Simply, I mean, this is kind of you saying it simply and bluntly. There's no other way to put it. It is shown to be an independent risk factor. visceral fat, truncal fat. There are ways to measure that. I would say, rather than to get into semantics about truncal fat or skeletal muscle mass, or the question is valid, but I'm taking this in a different direction. Just be at a healthy weight. Just strive to be at a healthy weight. It's easier said than done. I realize it's hard to lose weight. Strive to be at a healthy weight, right? I mean, if you're at a healthy weight, if that BMI number is acceptable, you calculated your numbers and BMI is acceptable, we won't be even talking about truncal fat because your waist would not be quote unquote generous, big, right? So, but the question is good. It's really the truncal fat, what they call visceral fat. So which just makes sense because when your waist enlarges, you know, you go from whatever size to, let's say, I don't know, 30, 32, 34 to 40, 44. What is that extra size in the waist? It's fat, correct? It's not muscle. It's fat, and the talk is about fat and fatty liver. So that's unhealthy weight you're carrying around your waist. If you're carrying it around your waist, it's elsewhere too. It's in your thighs, it's in your upper body, and guess what? It's in your liver. All right.
Thank you. Rebecca McCoy, we see that your hand is up. I'm not able to unmute you. Are you able to unmute and ask your question? Or type it in chat?
You can move forward. She's unsure how to take that off.
Oh, okay. Thank you, Kartisha. Are there any other questions?
Well, even if there aren't, you know, this is always available. Jennifer, this is recorded, correct?
It is.
This is recorded, and you know,
Yes.
we have the sources out there, and we will continue to talk about this. We will continue to promote it. October is Liver Health Awareness Month. Big issue. Again, big points. Liver disease doesn't just come from alcohol. Point number one. Point number two, numbers, national numbers, statewide numbers is a big issue. 100 million, 25 million. And then know your own number, right? Know what your own healthy weight should be, which is surprising to me that a lot of folks, most folks that I see don't know. They don't know your their own healthy weight, quote unquote, in their, you know, normal range. So those are the big points. We will always keep advertising this. And of course, Texas Liver Foundation will keep working on this particular issue as well, amongst other liver diseases. And we value their partnership here at Houston Methodist. And we will keep at it.
Thank you so much, Dr. Khan. There are thank yous coming in the chat, and I just again can't stop thanking you. This was such valuable information, so informative, and we are just so grateful for you spending your time with us today.
Of course, anytime. And as I said, this is a little late coming. We wanted to do this sooner. Hopefully, we will be more engaged with the public, with the consumers, and vice versa. We want this bi-directional. Somebody mentioned, how can we get our doctor more engaged? Actually, I'm not talking about anybody, but you know, from a personal point, if somebody says that, that's a little embarrassing as the doctor. The doctor should always be engaged. So how can we get the doctor more engaged in the liver test? Oh, it's no big deal, right? That should never happen. But we will be more engaged from now on. 2 years were lost to COVID. And of course, during those years, fatty liver didn't go anywhere, sadly. In fact, even more prevalent because people were sitting at home, sheltering in place, you know, don't stay home, stay safe. We used to use that term, but they were sitting at home and eating. And unfortunately, we're seeing the effects now in 2022 and 2023. People whose fatty livers were doing well, you know, they were losing weight. I see them now, they're like 30 pounds heavier, 25 pounds heavier because they were at home. So we need to really pick this up again and go from here. And we are here to help you and move things along. Thank you, everybody.
Thank you. Renee?
Hey, Jen, thank you, Dr. Khan. That was absolutely incredible to kind of repeat what he has said already. It's not always about alcohol consumption. Know your numbers. Talk to your physician. Talk to your physician about your test. If you could bring that slide back up with the contact information on it. I just wanted to remind you, Dr. Khan is here. He also has an entire GI team that is available for you should you have other GI issues. The phone number to reach our GI office is 281-422-0666. 888-222-7970. If you know yourself something is wrong, follow your instincts. Make a call to that office, get an appointment with Dr. Khan. Should you require surgery, he does have direct access to those transplant specialists, and we have surgeons here who are able to intervene on your behalf as well. Jen, I'll let you take it home. Again, thank you, Dr. Khan.
You're welcome. Thank you, everyone.
Thank you, everyone from Houston Methodist Baytown. That concludes today's Doc Talks webinar. We are so grateful for you all spending your pre-lunch time with us. And now everybody's going to look at their lunch a little differently when they go on.
I didn't want to say that, but yeah.
Healthy choices. Just a reminder, we've said it a couple times, this webinar is recorded, will be on our website, www.texasliverfoundation.org within a couple weeks. If you have any questions, feel free to reach out to Texas Liver Foundation at info@texasliverfoundation.org. And I hope everyone has an amazing week, and we hope to see you on the next Doc Talks. Thank you all.
Thank you. Bye-bye.
Bye-bye.